most famous physical therapist on the internet.
Hi folks, I'm Bob Schroep, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about top 3 exercises for TMJ, temporal-mandibular joint pain. This is, or disorder.
Right.
And this is an updated video. We did this one in the past, and now we're going to improve on it because I'm sure the audio is poor on the last one, right?
Right, Bob. And my hair was messed up. There was a couple of things that I wasn't happy with.
All right. Well, if you're new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. Also, if you get a chance, go to our website, bobandbrad.com.
Here we go.
And go to the giveaway section. We're always giving something away. What are we giving away, Mike? No, nothing. We're giving away, starting tomorrow, we'll be giving away something, right? Thermotex, I think, tomorrow.
There you go.
Thermotex infrared heating system. Those are
wrong.
awesome. So go to the giveaway section. Also, you'll find it on Bob and Brad Facebook. Short version of us, go to Twitter or Instagram, 60 seconds of Bob and Brad a day.
All right.
All right, Brad, where are we at?
TMJ, temporal-mandibular joint.
Yeah.
It's talking about the jaw. The jaw and the joint that makes your jaw hinge and open and close. And can you zoom in on that, Mike? Now, if you've got what we call TMJ, what really should be TMD disorder as opposed to joint, is like this particular skull has TMD. It's got a disorder.
Yeah, look at that.
It just opens up the joint right there, and then when he opens, it clicks.
Yeah.
Painful, earaches, headaches, a number of things that are not comfortable. Why don't you show a healthy TMJ
Yeah,
joint?
if I remember right, Brad, I actually think they actually slide a little bit and then rotate.
Yeah, if you want to get technical, I think you're right.
But you can see this one's nice and smooth. It's got a little bit of cartilage there, and that's all in order and in place. So this one, he's in good shape.
Right. So what we're going to do is show you
all his teeth too.
Yeah, a few things to strengthen the muscles and help the mechanics of this so that you can continue your life in a much more enjoyable manner.
All right, let's get started.
All right. So first thing, very critical, posture. You need to sit up tall, shoulders back, arch the back, bring the chin in.
I think this surprises people, Brad, because posture even affects your jaw. Try to drink water or eat with poor posture, and you'll see right away how that affects your throat. And it's the same with your jaw. I mean, you really need to look at that, probably the first thing.
As well as your swallowing.
I
mean, the body just works overall better, and this is just one section of it. So what we need to do is get that posture first. One thing, this is interesting. I need a chair, Bob. Just keep him entertained while I get back.
All right, he's going to get a chair because Brad's never prepared. So here we go.
That didn't take long. There's some muscles right back in here that if you stretch them with your hands, I'll show you a little massage technique. Just bend forward and pull them right up, right where the cervical spine meets your occiput, or that muscle, like skull pan, if you will.
We call it the sub-occipital area.
Yep, thank you. And you don't have to spend much time doing this. And then once you get done with that, then you get in your good posture, and then you're going to do some chin tucks and scapular retraction at the same time. And nice breathing. Make sure you don't hold your breath while you're doing this. You can do a little chin tuck here. A lot of people, when they do this, they'll feel those muscles stretch additionally. Okay.
What's nice about this is not only an exercise, it's a reminder.
There you go.
So if you're working, do a couple chin tucks, do a couple shoulder retraction exercises, and you'll find yourself in the right position, in a better position for the jaw.
Right. So once you get that, you don't need to spend too much time on that. 10 reps of that and about 10 reps of the spleen massage. Then we're going to go into, this is simple, and you take the tip of your tongue and you put it right behind your teeth, your front teeth, where the gum meets the teeth.
All right, right there, got it.
Like that. And you just hold it there, and then you're going to open and close your mouth halfway. It's not real hard. It's not a hard exercise.
No, it's really easy to do. You can do this one obviously through the day.
Yep.
You know, you could do this in the car.
Right. And actually, you can do these 6 repetitions 6 times a day is recommended.
So quite often.
Right. Yeah.
Okay. So takes a bit of work to get rid of these problems because you develop them over time,
Right.
and you need time to resolve them.
Right.
So
And then we're going to do some isometric strengthening to the jaw muscles. And you're going to put your hand right underneath your chin and keep your chin or your jaw open about halfway. And then you're going to open your jaw and you're going to put resistance and you're going to hold that for 6 seconds. And
so you're trying to open your jaw.
Yeah,
you're really not open. I mean, it's already halfway open. You're trying to open it further, but you won't let yourself.
right, you're maintaining a isometric contraction with opening. You do that 6 times. And then you're going to grab where the part of your jaw comes over here. Then you're going to grab it and then try and close your jaw. So teeth to teeth, but don't make sure there's space between your teeth.
So again, kind of half open.
Yeah. And then try to close, but resist it with your hand. And you make those little noises. It sounds like you're working
Yeah.
harder.
The other thing, when you're doing these exercises, the opening and closing, make sure the jaw is nice and aligned.
Right.
You don't have it, off to one side or the other.
Right. Well, it's it's just like this.
You want to strengthen it so it's in the right position.
Exactly. Exactly. Now this next one, we're going to go right to left with isometrics. And again, if these are painful in one direction, you're not going to do them that way. You're just going to do them to the pain-free side.
Gotcha.
And then go back to the painful side over time, and it should begin to get back in place and be comfortable. So open the jaw again, hold here, and I'm going to push my jaw to the right, but I'm going to hold it 6 seconds. And do that 6 times, and then to the left. We're not going to do all 6 here. And do that, and make sure you give it a rest and open and close your jaw between the reps, and do that
again 6 times a day.
You can do it up to 6 times per day. That's quite a bit for these resistive exercises. I think the isometrics, you may fatigue out.
Sure, but again, such an easy one to do while you're watching TV. Every time you see a commercial, I guess nobody watches commercials anymore, but anytime there was this, break.
What do they watch?
They just
fast forward.
Yeah, they fast forward, or they have Netflix, and there are no commercials.
Yeah, that's what I do.
Yeah,
and so then. Actually, that's it, Bob.
Yeah,
I thought we had one more, but
no, that's real simple, and it's like any other joint. If any joint's giving you a problem, you strengthen the muscles around it and can help decrease the pain in that area.
Right.
So the muscles take up some of the stress then, as opposed to the joint.
Right.
So
and again, just remember, they should be pain-free. If it's painful, like the pain you get from it, then you want to avoid that particular motion initially.
Yeah. And if possible, get a partner like I do and let him do all the talking. That way you give your jaw a rest. So,
all right.
Thanks for watching.
Take care.